High school students prepare for healthcare careers, a behind-the-scenes look at your medical bill, and battling childhood obesity. This is Carolina's Healthcare System Network News. The healthcare industry is booming, and according to the Labor Department, it is primed to add the most new jobs between now and 2022. These high school students are preparing themselves now to take advantage of that trend.
I am interested in the healthcare field because I love helping people and I would love to take care of people. It gives me an insight on what it will be like to work in this career field and what it will be like to help people on a daily basis and what my future could look like.
The Career Pathways program is a partnership between MECED, a nonprofit organization in Mecklenburg County that promotes public education, and Carolina's Healthcare System University. 10 to 12 high schoolers participate in a 6 to 8 week program that gives them a taste of what it's like to work in healthcare. Here, they shadow clinicians in different departments in the hospital and intern at local system medical practices.
When we recruit these students or when they come, my goal for them is not only the health world, but the real world.
So it really helps them understand, like, this is what I really want to do. You know, this is what it's going to take to get there. It's really about exposure coupled with post-secondary exposure. So not only do you get to see the career path, but also what the educational side of what that may look like.
I'm interested in this career because I want to be a traveling nurse and go across countries and help other people out. It can further prepare you for life in a career, and it's actually an eye-opener into the nursing field.
Whenever you visit your doctor's office, go to an emergency department, urgent care facility, or any outpatient healthcare setting where you need to be treated for an illness, accident, or other condition, you receive a copy of a document that has a lot of numbers and words on it in little boxes. Your doctor has circled some of these numbers and boxes, gives you back a copy of the sheet. Do you know what that piece of paper really means? It's a listing of the codes that describe your condition. It's called ICDs, or the International Code of Diseases. They describe in minute detail what your condition is. In fact, the codes are now up to version 10, which breaks down your condition into even more detail. Why is this necessary?
These codes are necessary because we need to describe the care being delivered in a lot of ways. So now you don't just describe this was their diagnosis and this was their procedure, you describe their entire continuum of health.
Here's the scene. You walk into an emergency department. The doctor treats you as quickly as possible. You walk out with a copy of a piece of paper with numbers and boxes checked. Another copy of that piece of paper goes to someone who can put all these codes together to determine, wait for it, your bill.
Once the patient is seen by the physician in the emergency department, the physician documents the case and it enters into our system called Cerner. We list at least 3 reasons why the patient comes in. From there, we look at a lot of the review of the systems, information that the doctor documents, and his final diagnosis, and we code it into our system. It takes about 3 to 4 minutes depending on the severity of the chart. It's very descriptive. We do left or right, laterality. It also goes all the way down to specific as far as the type of injury that the patient may have.
What about downhill skiing and you run into a tree?
Yes, there's a code for that.
Eating too much candy?
Yes, we can code that also.
Here's a classic. Getting your tongue stuck on a frozen pole.
Yes, we can code that also.
No matter what the condition, mishap, or encounter, there's a code for it.
I've actually had an account with a peacock and also a cow.
Wonder what that was about. The childhood obesity epidemic now stands at nearly 18% among 6 to 11-year-olds. 2 recent studies take aim at possible ways to reduce that number. In one study, researchers found that if you put warning labels on sugar-sweetened drinks, similar to the ones found on tobacco products, parents are less likely to buy them for their kids. 3 types of labels were studied. Parents looked at drinks with a label warning that added sugar may contribute to obesity, diabetes, and tooth decay, another drink label that only showed the calorie count, and yet another drink label with no label at all. The result? The warning label was the winner in causing parents to stop and consider the purchase. The researchers concluded that these labels may be an important way to educate parents on the health risks linked to a steady diet of sugar-sweetened drinks. In another study, the question was asked, what's a good breakfast for kids? The answer, a high-protein breakfast, according to the investigators. A breakfast that included eggs, for example, keeps children fuller longer than cereal or oatmeal, causing them to eat fewer calories at lunch. When a small group of 8 to 10-year-olds were given a breakfast of scrambled eggs, whole wheat toast, diced peaches, and 1% milk, they ate fewer calories at lunch, 70 calories fewer. That equals about 4% of a child's daily caloric intake. Eating beyond that 70-calorie threshold, even by a little, can cause excess weight gain and obesity if it continues. Sugary drink warning labels and a high-protein breakfast. Important implications for obesity prevention in our youth.